Hi, I'm Dr. Aunna Pourang, and I'm really happy to be here today to share some effective communication tips with nurses. I am a family physician who practices integrative medicine in Los Angeles, California. So I think really one of the most important tips I can offer before I say anything about communication is to understand that everybody has a vital role to play in healing. And a good healing environment requires that we respect everybody and ourselves, because when we respect ourselves as physicians, then we can respect our patients and the other people that we work with. So tip one is really about respect. Be respectful with your interactions with nursing staff. I think you want to allow open communication with the nursing staff, and it's hard for a nurse who feels like they're being stonewalled or they feel like they're bothering the doctor, and oftentimes they won't want to tell you things that might be really important for patient care. So I found that allowing nurses to come communicate with me openly has really fostered a really wonderful healing environment. I get things done faster, I catch things faster with patients. Number two, tip-wise, is to be proactive and not reactive. It's really easy to lash out at people when we're stressed out, and I think it's really important to realize that nurses are doing their job. They're communicating to you what they're seeing, and if you're feeling stressed out, it's important to take a deep breath before you make a decision as to what you're going to say before you lash out at somebody, because in the end it can really hamper and hinder the communication with that nurse, and again that will interfere with patient care. And I think the last but most really important tip that I can give is that it's important to listen to what nurses have to say. They're working behind the scenes, they're seeing the patient. Oftentimes they know a little bit more about the patient's personal preferences than we do. And if they're respectfully giving you a recommendation as to what to do, take that into consideration. Don't be afraid to ask the nurse, what do you think we should do in this situation? Because ultimately, it's a win-win effort when we understand that we're all involved in this together to really help people. I just wanted to say, you nurses rock. I really respect you and admire you. You've helped me really save a lot of patients' lives in more ways than one, and you've been a friend to me and just make it so much more satisfying to work. I couldn't do it without you. Love you all, grateful for you, and happy National Nurses Week.
Greetings, my fellow nurse brothers and nurse sisters. Welcome to the medically affiliated nursing channel. Thank you, Dr. Aunna Pourang, for explaining your 3 tips on how to discuss effective communication with the nurses. Now, my 3 tips that I have for the nurses to have effective communication with the doctors, they go hand in hand. We cannot do this without you guys. We are an integral part of the medical system. So for all of us being in this field, it's very important. I love your 3 tips. Now, for our nurses, I have 3 tips on how to have effective communication with the doctors. If you're in the ICU intensivist, if you're in the medical field with the doctors there, or if you're in a specialty unit, how to communicate with the doctors in that specialty. So number 1 that I have, the very most important tip, is once you have your information about your patient that you want to call the doctor for, have it all together. That's very important and it's vital. Have the medical record number, what the patient's name is, and what you're calling them for. Very professional, effective communication, that's number 1. Tell them exactly who the patient is, what they're there for, and what you are asking for as a problematic, or what you can do to have the doctor be aware of a change of condition. So number 2, the other tip that I have for you is it's not what you say, it's how you say it to the doctors. When they come in, have respect, like our doctor previously said. So you can actually say something and always greet them and say, thank you, good morning, how's your day going? Don't yell, don't speak too loud, just have respect when you see the doctors, because honestly, we are in a professional environment. So remember how when you speak to them, always talk to them very professional and say hi, meet and greet, and then don't ignore, because we all work together as a team. The third tip that I have for you guys, coming from a nursing perspective, is always communicate with them. When you see them, talk to them real quick, ask for an update. How are the patients doing? What do you think we should do for the care plan for the patient? Sometimes we may call the doctor too much, and some nurses maybe have a feeling where they don't call the doctor enough, but you have to have it right state of balance, so that way they have trust in you as a nurse to take care of their patients. So once you have that set together, everything kind of comes in one piece. So hopefully those are 3 tips that help you guys, my fellow nurse brothers and nurse sisters. Thanks for tuning in. Any comments, any other descriptions, put it on the bottom. Let me know. Thank you again, Dr. Aunna Pourang, for doing your thing and helping us represent all of us in the professional medical field. My fellow nurse brothers and nurse sisters, I'll talk to you guys later. Peace.